The simple answer is yes, indeed. The more elaborate answer is yes. I think there are a lot of questions that I've not been able to answer. This is also the beauty of being part of a global community of researchers, because other people are using different methods, and I think each other work is complementary. In my case, what I would have loved to do more carefully first was to expand the analysis, as I mentioned at the beginning of my presentation, beyond Europe and North America. We do have a lot of studies of irregular migration and the rights available to irregular migrants in North America. We start to have a significant body of information on Europe. Very few people have worked in different contexts, and I would love to do it, but to be honest, not being familiar with different contexts and not having contacts on the grounds for me was a major limitation, which is why I base my comparison in Europe, only in different countries of Europe. I do think it would be a lot more interesting to compare other communities in different contexts to see whether some of the factors that we normally consider when studying the drivers of policies towards irregular migration, for example, partisan preferences, economic considerations, the role of advocacy coalitions and their capacity to shape the preferences of different governments, and finally also the salience of migration in the public debate, whether those factors also apply in different communities or whether this is not the case. I think this is one thing that I would have loved to do. I think I'm still on time. I don't want to do it alone because, as I mentioned, I just don't have familiarity enough with other contexts. But I'm hoping every day for people to get in touch, to contact me, so maybe we can develop research projects together. That is one. And the second part of your question is whether the methodology that you use is conducive to the outcome that you hope, or whether it's not. Of course, all the methodologies have limitations. So the outcome in the end is always probably less comprehensive than what you hoped for. The project, when you write it down, it's definitely more ambitious than how it is published at the end. I think my conclusions have always been fairly tentative, even those two papers that I mentioned in my presentation. Specifically, I think for me, I would always wanted to interview more people, a higher number of actors involved in decision-making processes, again, to get a fuller picture and to hear more about the ideas of those who opposed the expansion of rights for irregular migrants for different sets of reasons. And again, in the case of the study on the mortality of irregular migrants and our finding that irregular migrants die more often for infectious diseases and also for external causes like suicide than nationals. I think there it would have been great to have more data on who those irregular migrants are in Switzerland, but also in other countries. And some people have done a fantastic work in trying to estimate some of those aspects, but we just don't know. It's incredible how nowadays we have very accurate data on, for example, the number of regular migrants in different countries, what they do, where they live, but we're still in the darkness when it comes to irregular migration, which I think is a good reason to conduct research on this population, and not only on irregular migration journeys, because there is indeed a literature on this, but also more specifically on the conditions of living of irregular migrants once they are settled in a community, the type of challenges that they encounter. Sometimes maybe they manage to navigate well despite their condition of irregularity, and also the type of networks that exist to provide them with rights. I think we are all confronted with ethical issues when conducting research on migration to different degrees. For me, I always chose the easy way in this, because, as I said, I never really tried to gather interviews with irregular migrants themselves. And I always, when I would talk about this issue with doctors or with policymakers, I would never ask them to report on a specific case or to give me names, of course. And that kind of made it easier for me, because then we were speaking about a more abstract, if you wish, population, without the risk of putting anyone in danger. And the same for my other research on using public health registries, the registries of mortality. What we did, we aggregated data at the national level for Switzerland, and then we aggregated them for different cantons. And initially, we wanted to go even more in depth and look at different municipalities. We did not do it for the simple reason that there would have been too much, that the sample of individuals in each municipality would be fairly low. And so it would have been relatively easy to have specific information on the individuals that we were studying, their age, their gender, and we did not want their nationality, and we did not want that to be the case, which is why we always kept a certain level of aggregation, so that, of course, we have an idea of what is the, let's say, the average age, for example, of irregular migrant when they die, but we cannot link it to the specific profile of one person. I think that's key for people conducting the research on irregular migration as I do. As I mentioned, there are other people, and I really commend them for their work and for their drive, who do ethnography with irregular migrants. And there I think there are very difficult ethical challenges on not only how you collect information and how you gain access to the community that you study, but also on how you report and how you disseminate your findings. In general, I think, again, linking to your question, these also comes with limitations, because I think if you do ethnography, then you're probably bound to study fairly specific groups of irregular migrants in a given community. So, I don't know, for example, there has been some excellent work on the communities of irregular migrants who are Turkish in the Netherlands. That is clearly not representative for all irregular migrants, because irregular migrants coming from different communities may have very, very different needs. So that, again, is one limitation. The question is very good, because, for example, in the case of Italy, I'm sorry to be talking about the place where I was born and where I work now, actually, but there was a law approved in 1998 that says explicitly that everyone, regardless of their legal status, should have access to a certain range of health services in public hospitals. And that was very important, because I think it put many people in the conditions to live a dignified life in the country, even if they did not have regular status. And we saw that that was very consequential, for example, at the start of the COVID-19 pandemic. In some countries, irregular migrants were really afraid of accessing health care support because of their irregular condition. In other countries where there had been laws that made it very clear that even if you're irregular, you can still access not only urgent healthcare services, but also more advanced healthcare services, then it was probably easier to include also irregular migrants in the response to the pandemic. Think even about the case of vaccinations. In some countries, it became very difficult to find a way to give vaccinations not only to the general population, but once that was managed to those who are in a irregular condition. So I think that the law can be very consequential. And here I'm talking, of course, about the rights that are given to people once they are already settled in a community, because this is the sort of work that I've been doing. But we can also think of the law as helping to improve on people's lives when they embark on a migration journey, because that's, of course, many other people and many of you are actually studying and researching on. And in the case of irregular migration, it's clear that, for example, in Europe, there have been very few possibilities for people coming from other countries to travel regularly to European countries. And this has led to an increase in the number of people taking on irregular migration journeys over the last few years. So of course, this is on the agenda of many policymakers, but then again, the law and the creation of so-called regular migration pathways or the lack of creation of those pathways can be very consequential, not only for those who are affected, for individuals, but also for communities. The moment you have a much higher number of irregular migrants, there are problems. Not necessarily, there are problems because you want to make sure that people have the same information, have the similar conditions of access to rights, and if many of them are irregular, then this is more difficult to do. Again, this is a preliminary answer, but I'm glad to exchange more, and I really thank you for the interest in this research. Of course, that's a very relevant question for all of us, because COVID-19 had such a gigantic effect on our lives, and especially on the lives of people who have a migration background or are engaged in the migration process at the moment. For me as a researcher, actually, COVID-19 triggered the question of why did some governments expanded the provision of rights for those people who maybe have a precarious legal status or again are irregular migrants, and other governments did not. I think in this case, and because of the global reach of COVID-19, the pandemic can really be used as sort of a litmus test to understand different priorities and how they play out in communities, depending on their political preferences, economic situation, administrative capacities, public health capacities, and of course the severity of the pandemic when it hit. So for me, the pandemic actually did not mess with my data, because I think the two articles I presented, discussed today, draw on information I collected before the pandemic. And I think the findings can actually ring even more true now after the pandemic. But the pandemic just made some of the questions that I was already asking myself even more urgent in a way. And those questions are about the reasons why governments or communities have a completely different approach when it comes to irregular migration and the provision of rights. And I do think this is an opportunity because some policymakers are now more willing to listen. They can see that the evidence coming from those from those trends of research is not only about politics, but it's also about public health, and it's about balancing very delicate considerations that have to do with the economy, that have to do with the sustainability of supply chains. And so it does, I think it does, of all the bad things that the pandemic brought, it does bring an opportunity to be listened by policymakers when it comes to research on those topics. Very difficult question for me to answer but I love to talk about it. And the reason why it's difficult is I'm not sure my research should have the policy outcome or a policy impact. For sure, I do want policymakers to read what I write and to listen to me, but I don't want to be prescriptive and tell them what they should do, because I think that's not my task. You know, our task when we conduct research is to do solid and scientific work. And I do have an argument in my papers, and you can go and read the argument of the paper. And I think if you read the argument, I mean, people would have a hunch of what could be the preferable course of action for policymakers. But again, this is not to me to decide. And I think policymakers should weight the evidence that I produce and that other people produce against other considerations that they may have, and then decide what to do. So this is just to say, I don't want to go to policymakers and tell them what they should be doing. I do want to try and give them some new evidence and show, for example, as I do in my second paper, that if you provide certain healthcare rights for vulnerable communities, this is a consequence, and those communities are likely to suffer less and to have life conditions that are a little bit more similar to the life conditions of your nationals and the other nationals living in the community. But then I stop there. I don't want to go beyond and force, you know, and say that policy makers get it wrong or they should change their course of action. I think that's also the beauty of separating tasks between scientific researchers, maybe think tanks that can be and should be a little bit more prescriptive, and policymakers and politicians.